The Association, excuse me, of American Medical Colleges is pleased to welcome you to today's webinar on optimal strategies for your residency application with a focus on family medicine. We are recording and we'll make the archive available after. We will email you once we post it. We muted all participant audio. If you need help, send us a message. The presentation includes time for Q&A. You may submit a question at any time by clicking the Q&A button at the bottom of your screen. To access the slides, please click on the Handouts tab where you logged in today. I'll also post a link there in the chat box. It's now my pleasure to welcome Cynthia Hutchinson. Cynthia.
Right, and thank you so much, Jennifer, for the introduction. Welcome to the Specialty Spotlight webinar on family medicine. My name is Cynthia Hutchinson, and I am a Director of Engagement for Residency Programs here at the AAMC. To begin today's webinar, I wanted to take a moment to give a little background on how this series came together. Each year, we hear from applicants, advisors, and programs that there's tremendous value in having a shared space to talk about the unique aspects of applying to different specialties. To help meet that need, the AAMC launched the Specialty Spotlight series in partnership with specialty organizations, advisors, and program leaders. These webinars are designed to offer clear, specialty-specific guidance straight from the experts so applicants can approach the process feeling more confident and informed. We see ARIS as a connector in the residency ecosystem, and this series is one of the ways we help bridge perspectives between applicants, medical schools, and residency programs. Whether you're hearing about family medicine for the first time or already on your way to applying, we hope today's session provides meaningful insight and support. We're thrilled to have you with us and excited to hear from today's speakers as they share their expertise on preparing for a career in family medicine. This recorded webinar includes a brief overview of the AAMC and updates pertinent to applicants for a given field, so for today, family medicine. After AAMC and ARIS updates, I will pass it off to our wonderful experts in the field of family medicine. Joining us today from the advisor perspective is Dr. Ann Rudder. Dr. Rudder is the Senior Associate Dean of Academic Administration and Associate Professor of Family Medicine at Albany Medical College. Following Dr. Rudder is Dr. Donald Raj Woollever. Dr. Woollever is President of the Association of Family Medicine Residency Directors and Program Director of Portsmouth Regional Hospital, Tufts University School of Medicine, Family Medicine Residency Program. Thank you, Drs. Rudder and Woollever, for sharing your perspectives and advice today. We will conclude the webinar with a discussion that begins with some questions we received at time of registration and then move on to questions asked during the webinar. The Q&A feature is open and we do have folks ready to answer your questions throughout the webinar. We likely won't be able to get to all the questions that have been previously posed or submitted today, but we are doing our best to answer as many as we can. We will also be providing helpful links and a copy of the slides used today along with the recorded webinar. Feel free to refer back to this material once it's posted. All right, many of you have likely heard of the AAMC, but I want to take a moment to introduce just a few facets of the programs and support we provide the academic medicine community before moving on to my ARIS updates for the upcoming cycle. The AAMC is a nonprofit association created to lead and serve the academic medicine community since our founding in 1876. Our mission is to improve the health of people everywhere. That is why our association supports over 450,000 members of the community, from medical students to program leadership to deans and DIOs. More recently, it's important to point out that the AAMC is leading the efforts to fight against NIH funding cuts so to protect the valuable research and education these funds provide and service to patients everywhere. AAMC, through the integration of ARIS and other partnership data, supports applicant journey through the transition to residency. It's not simply a transactional step, but rather part of an overall offering through the AAMC and others. And we are focused on strengthening the support to applicants, programs, institutions, and specialties. ARIS was built by and accountable to the whole community. These products were not built in isolation. All recent updates to My ARIS came from stakeholder input, feedback, and research, including 40+ working group meetings and inputs from thousands via surveys, one-on-one meetings, and focus groups. The same approach is used to develop the other services around ARIS, including the Dean's Workstation and Residency Explorer tool. I want to take a moment to highlight the exceptional tool offered by AAMC, the Residency Explorer tool. Residency Explorer tool continues to be a highly utilized tool for applicants and advisors to compare program offerings and to assess competitiveness in order to form program lists for sending in applications. The AAMC's Admissions and Selection R&D team is innovating the tool based on research and community feedback. Based on your valuable feedback, the Residency Explorer tool has expanded data this year, including increased specialty coverage from 25 to 40 specialties to provide broader insights across more fields. Integration of National Board of Medical Examiners and National Board of Osteopathic Medical Examiners licensure score information, including program level Step 2 CK and Level 2 CE score ranges for applicants invited to interview. More detailed NRMP program position data showing total positions offered and filled by all residency position types. And coming in August 2025, enhanced program-specific details, including application process information and updated license exam results. We'll drop the link in the chat now. We will now move on to important updates for family medicine applicants as we enter into the 2026 ARIS cycle. First, let's start with program signal participation and what that means for family medicine applicants. During the 2026 ARIS cycle, family medicine applicants will have 5 program signals to use. This is the same number as prior years. Once you submit your application with a signal, the signal cannot be taken back. It is permanent. So we recommend double checking program signal status after August 20th and before you begin to submit your applications on September 3rd. This assures each signal is used in a productive way. As a reminder, program signals are a way for applicants to show true interest at time of application. For this reason, the AAMC recommends signaling all programs for which you have true interest, including home programs and programs to which you rotated for away or audition rotations. An upcoming update to the MyARIS app that all users, regardless of the specialty they are applying, will see is in the interruptions or extensions section of the application. If you have no interruptions or extensions, simply click no on the radio buttons for each of the 2 questions on this page. If you have had extension or gap for academic or professionalism reasons, you may need to be aware that you may need to answer one or both of these questions based on your unique situation. The first question is identifying if an extension or gap was academic, meaning it was related to repeated or remediated coursework. If the answer is yes, select that response and provide a short explanation in the text box that will appear. The second question is regarding an extension, leave, gap, or break due to a professionalism sanction or other adverse action. If the answer is yes to this question, select that response and provide a short explanation in the text box that appears. Please note that neither of these questions are intended to solicit information about your health, disability, or family status. As such, if you have questions about how to answer either or both of these questions, we recommend meeting with your academic advisor to complete this section as accurately as possible. Now, let's put together all of these features in a timeline for the upcoming recruitment cycle. On June 4th, the ARIS season officially began. In June and August, Residency Explorer data refreshed or will refresh with the additional information previously mentioned. On August 20th, that's the last day programs can opt out of program signaling. So if you're looking at program signal status after this date, you can be assured the information is accurate for planning out your signal strategy. On September 3rd, you can begin submitting applications and associated signals to programs. Take the time between August 20th and September 3rd to double check signal status before submitting applications. We all know what occurs after that. Lots of interviews and decisions being made, and we at the AAMC wish you all the best of luck during this process. Last but not least, I'll pause here so you can take a picture of the different QR codes to a wealth of resources available on the AAMC website. Feel free to snap a photo and reference this at any time in the future. I will now pass off to Dr. Rudder for the Medical Student Advisor perspective.
Hello, everyone. Thanks so much for joining us. As Cynthia mentioned, I'm Dr. Annie Rudder, and I've been had the pleasure of helping students who are seeking family medicine positions in the match for the last over a decade now, and look forward to sharing some of that with you today. Next slide. So one of the things that we want to talk about is what could you be doing now? So what can you do in preparing your application for family medicine residencies? And there's one concrete thing you can do is update your CV. This is something that you've done before, it's familiar to you. So while the ARS process and residency application process can seem overwhelming, this is something that you can do today and start thinking about how this can be a useful tool as you prepare your application. It can help you as you start thinking about, the ARS application is not merely a transference of your CV into ARS. It's much more structured and thoughtful than that, but it can give you some background information. It is also extremely useful for you as you're providing information to your letter writers. They can review your CV, be reminded and be explained the different things you've done over the years here, during your medical school journey. One of the ways that you can consider building your CV, because many of you have maybe not done this since you were applying to medical school yourself, is to do something that's called a brain dump. This is where you basically set a timer for 8 or 10 minutes and with no distractions, just take out a piece of paper and a pen, old school, and write down everything you've done during your medical school journey. If you helped in a flu vaccine clinic, if you helped bring a speaker to campus, if you were the leader of a club or you were on a research project, all of these things can be sort of written down and then organized into your CV to decide what's meaningful, what isn't, and then ultimately what is going to be used to build your application. It's a great time also now to be really reflecting on your interests and values. And this is what's going to help you find the perfect fit. Not only help you decide is family medicine the right specialty for you, but within family medicine, there are over 800 family medicine residency programs. How are you going to work with your advisor and your family and others that matter to you to figure out what is the best fit for you? What are the things that have been important to you in the past? What makes you uniquely you? And so this is what you're going to do to help build your application. Why are you interested in family medicine? What is it about the specialty that speaks to you, that makes it something you feel you could do for the rest of your career? And then ultimately, how do you envision your future career in family medicine? This is, when you can think forward about what you're hoping to get out of your training, it will help start to build make the connections for where you want to be in your training, what program or what area or what region or what type of program, rural or urban or suburban, is a good fit for you. And then take a few minutes to organize your thoughts. You can highlight some themes on your CV, think about influential patient encounters, consider what strengths are uniquely yours and what you'll bring to a specialty and what you'll bring to a program. Next slide. So as you're preparing your ERAS experiences, this is something that you're going to be able to put on your application. The first step is to know what the application looks like. So using this QR code, you can download the worksheet. It will have specialty specific questions, and it's a great place to really draft your application, take a look and see what you're going to be dealing with when you log in. Then you're going to prioritize your experiences. And in my experience, what I've learned is that family medicine residency programs are extremely interested in things that matter to you. What have you been committed to? It doesn't mean necessarily that you show commitment to the specialty of family medicine since the first day of medical school or since the first day you were 12 years old and decided to become a doctor. But what are you passionate about? Is it a region? Is it a population of patients? Is it a disease state? Is it a project or research that you've done? Is it a volunteer experience you've had? Most programs are looking for recent or more longitudinal commitments, things that really reflect your core values, that demonstrate leadership, things that matter to family medicine program directors. They want leaders in the field. They want people committed to primary care and family medicine. And this ultimately is what your application or what your interview questions are going to be about. So what you put in your application is actually exactly what you're going to be asked about. And so this is your opportunity to put forth the things you like talking about, the things that make you able to speak to your strengths, to things you've learned, and who you want to be and who you are. You will have to select 10 experiences. This is narrowed for many of you from your full CV. Others of you, you may not have 10 because you've had more robust or longitudinal experiences. But, put together a draft list of 10. Think about, what were the 3 most meaningful? Why was it meaningful? How does this demonstrate your core values? How does it demonstrate who you are, or who you would be as a family medicine resident? Review this list with people who know, with your advisor, with your mentor, with a faculty member, with, whoever you're connected with that can help you move through this and really put your best foot forward. And again, describe who you are in your application. Your application should tell your story. Next slide. One of the hardest things to do with so many residency programs across the country is to develop your program list. And this can be challenging for a lot of different reasons. The volume of programs is one of them. But think about, like we talked about in the previous slides, what factors are most important to you? What are you looking for? If you have a passion for a specific fellowship opportunity, you want to do sports medicine, what is exposure to sports medicine going to be like during your residency journey? If you want to be in a rural area, if you want to be taking care of, refugees and immigrants, if you want to be caring for an LGBTQ plus population, what are the things that matter to you? And recognize that that may be different from the family medicine applicant sitting right next to you. And so utilize the careers in medicine residency preference exercise. This is an opportunity for you to really reflect on what matters to you. Consider your candidacy as an applicant. So thinking about what programs are, more likely to match someone like me with my characteristics and my profile. What are places that might be more out of reach or competitive for me? What are some programs that, might be a really great fit or a really sort of a place that you've connected before potentially that would be a good opportunity for you. There are several databases out there, so you can use Residency Explorer that Cynthia talked about earlier. You can also use the AMA has the FRIDA website. These are verified data sources. This means that they've confirmed that this data is accurate. There are many other resources. Texas Star is one of them. Google Sheets, Reddit, all sorts of things that are out there that are self-reported. And I put those on there because I wanted to just give a brief moment of warning that self-reported data is self-reported data. And so be really cautious of who's providing it, what they're saying, what their expertise is in providing that information. Are they an applicant just like you and it's something they read on a website or heard through the grapevine or saw on TikTok, or is this something that's accurate? And so making sure you're being picky about your data sources. Next slide. And so when you're developing your program list, really do your research. This is an opportunity for you to look at websites, look for programs' mission and values, not just flashy pictures and great videos, but really think about, does this program speak to me and what I'm hoping to get out of residency? Your advisors likely have some background information on match trends for your school at different programs. Where have your students and your previous colleagues been successful? Where have people with previous, similar profiles to you, with similar academic strengths as you, how have they done? How have their match rates been? Use your alumni network. Many schools will have an opportunity to connect with alumni who matched into family medicine in previous years and can make some connections for you. You want to be in Seattle. Oh, we had a student match in Seattle several years ago. Let's make that connection, see what it was like, give you sort of the information that their experience was like. And then draft a list, see what happens, is this, get input from others, think about your career advisors in your student affairs office, your specialty specific mentors. If you're at an institution that has a family medicine residency program, is that someone you can go to talk about what their experiences have been over the years? And then as you're working through this, you're going to consider potential programs to select for your 5 signals. So it's really important to recognize that every specialty has a different number of signals. Some of them have tiered signals. Family medicine has 5 program signals. Remember, these signals are intended for you to use at the time of the application. And this may be an opportunity for you to express interest and potentially get you an improved opportunity or chance of getting an interview somewhere. Program signals are not intended to signal the program that eventually is going to be top on your rank list. There is an expectation that the signals are the first part of the story and that then the interview comes and then ranking comes after that. And so think about, which programs seem to reflect your values, seem to have what you're looking for, and then go forth and go through the interview. And it's okay if that changes, but the program signals are sort of that initial first step in trying to identify programs that might be the right fit for you. And then make sure that you're reviewing this list with people, again, who knows, if you have, for example, a step one, fail, is that something that is going to be okay for certain programs? Which programs are going to really look at your leadership responsibilities and leadership experience over an academic misstep? And how have your advisors seen that potentially play out? How do you find the programs that are doing more psychiatric care or addiction medicine, more sports medicine, or other clinical topics that might make the most sense for you? Next slide. And these are, again, we talked about this a little bit, but these are some factors to consider when you're kind of making your list of programs. And that could be, what type of program is it? Is it housed in a community hospital? Is it at an academic center? How long has the program been around? How are they accredited, through ACGME? Then for you as an individual, geography, it's okay that matters. You want to live somewhere you're going to be happy for the next 3 years as a family medicine resident. What community are you going to be in? Again, we talked about this: mission, vision, values, culture. What are the things that matter to the people who live and work there? And is that the same stuff that matters to you? Program size, curriculum, patient populations, all of these different things. What do their graduates do, right? Alumni career paths. Do you see people going into the things that you think you want to do at this moment, as you're thinking about what your life after residency might look like? What's the balance of resident life and wellness, and what other professional opportunities are there, including fellowships? Next slide. And so the last couple minutes here, we're going to talk about a couple of brief things. One is preparing for your interview. So make sure you know your application extremely well. You have to be able to discuss, answer questions, describe the experiences that you chose, the research you've done, the projects you've been a part of. Make sure that you feel really confident in all of the components of your application. Make sure that you think about some of the clinical experiences you've had. Often programs will ask about your clinical experiences. Tell me about a time when a patient challenged you. Tell me about a time when, you felt vulnerable. Tell me about a time where you felt proud of the work that you've done. All of these things, if you can have some, not overly polished, but prepared answers based on clinical experiences you've had, that can be extremely helpful. There are a lot of resources out there. The AAMC has a virtual interview resource. Your school will potentially have mock interviews or interview prep. And again, review the program's website. It would be best for you to ask questions that are deeper than the superficial content that's on the website. Know the website well, so that you are going to be able to ask the harder questions, the questions that are really getting at culture and mission and other things than how many nights of call do you have on pediatrics, or how many, shifts in the ER do you need to do? Those are things you can look up. And so use the interview as an opportunity to dive a little bit deeper, and practice in the mirror, practice with your friends, practice on, a video, and then watch yourself answer some questions. All of these things can be helpful. Next slide, please. And for the last slide, last two slides, just flip over to talking about tips for advisors. So some of you on this call might be advisors, someone who is helping a medical student through this path. So you can download the ERAS application worksheet and other resources so that you're really familiar with this. You can also create your own practice account so that you can really answer the logistical questions for the students. What does this really look like? How difficult is it to do? Become familiar with the same resources your students are using. Look and learn the difference between the verified data and the self-reported data, and how do you sort of sift through that and help students understand. Lots of outreach to student. That might be meeting with them individually, reviewing their application details, program lists, their specific concerns, but also sort of more general outreach, an email to check in. How are students doing with gathering interviews, scheduling them? Are they struggling with interviews that are in conflict, and how do they choose which one to go to? You may want to track your applicant interview and process. This is how you build your own knowledge for future years. How can you work with your students and their experiences to help you become a better advisor in the years to come? How do your students do? What is the timing of their interview invitations? When do they, accept interviews? When do they schedule them? How should they think about their clinical rotations during interview season? And how does that work within your school? And then my best advice is to build a network. Try to connect with other advisors across the country, professional organizations like the AAMC, STFM, which is the Society of Teachers of Family Medicine, the Academy of Family Physicians, all have people who are in your shoes, and participate in listservs, conversations, go to conferences, and learn about these topics. And the very last slide for me, next one, please, is just about some other family medicine resources. So we've talked about a lot of these, but the last two are family medicine conferences. So many of you may be aware of the Family Medicine Future Conference. This is supported by the AAFP and is a great opportunity for you to meet with programs from across the country. It's the end of this month in Kansas City, but there are many other regional conferences that could connect you with some programs as well. And with that, I will turn things over to Dr. Wolliver.
Great. Thank you so much, Dr. Rudder. It is a real pleasure to join you this afternoon, this morning, this evening, whatever time it is where you are. My name is Raj Wolliver. I am a program director at the Portsmouth Regional Hospital in Portsmouth, New Hampshire. I've been a program director for the last 17 years at 2 other programs up in the state of Maine and now in New Hampshire. I'm also the president of the Association of Family Medicine Residency Directors, which gives me the opportunity to interact with other program directors from family medicine residencies across the country and in a whole variety of different settings. Next slide. So just to give you an idea of the breadth of family medicine, the Association of Family Medicine Residency Directors, or AFMRD, represents about 2/3 of the family medicine residency directors. And on last count, there were approaching 800 family medicine residencies. I think we're up to 771, and it may be slightly higher than that now even. So you can see that there are a large number of programs to choose from. We do our best as the AFMRD to represent that wide range of perspectives. And we don't only represent the program directors, but other leaders within that graduate medical education environment as well. So to me, that is one of the challenges that you face as a medical student, is trying to sift through the full range of family medicine residency programs that are available to you. Some are very academic and based at universities. Others are in very small towns. So you have the potential to choose from living in the middle of a city or living in very small rural communities. To me, that is the real beauty of family medicine. Probably many of you have heard a quote about family medicine, that we're the jack of all trades. And if you know that full quote, it says, jack of all trades, master of none, which doesn't sound so super. But if you hear the rest of the quote, is that it's a jack of all trades, master of none, but oftentimes better than a master of one, which to me is the real beauty of family medicine, is that we are often the specialty that brings in all of the inputs from the places that our patients go, whether it's to see the cardiologist or the physical therapist, or to work with a community resource. We are the place where all of that information comes back to try and filter it down. And frankly, that is the task before you as you think about how to apply for a residency spot in family medicine. Next slide. So from this data, you can see that there are a large number of applications to family medicine. You can see we're pretty consistently in that 14,000 overall applicant range over the last several years. You can see we attract a balance of DOs, MDs, and a majority of our applicants are international medicine graduates. As was already placed in the Q&A box, this large number of applications also means that there are a number of slots left over after the initial match period for folks to apply to through the SOAP process. I think family medicine is second only to internal medicine in terms of overall number of applications and number of available slots. Someone also asked a question about dual interest. As family medicine is a specialty that includes a wide range of areas, we require exposure to caring for adults in the hospital, for pediatric patients in the hospital. Our outpatient clinics require a certain number of older adults and pediatric patients. You're all going to be required to spend some time on the labor and delivery unit delivering babies. And so family medicine is still a specialty of variety. And so while historically we may have implied that we didn't want to know if you had other interests, we really do want to know. If you think you are interested in psychiatry, but also interested in family medicine, I would love to hear about that so that I can talk to you about all the behavioral health opportunities that are available within family medicine. If you have a real interest in delivering babies and are not sure if you want to do that as an obstetrician or as a family physician, I would love the opportunity to talk with you about all the ways that you can do that as a family doctor. So I would encourage you to be open and be honest about all of your areas of interest, even if some of those are not just family medicine, because I would love the opportunity to tell you about how you can do that within our specialty. Next slide. We've already talked a bit about signaling. 86% of applicants said that they truly were expressing their preferences on their signals. As Dr. Rudder already talked about, remember this is used at the time of application, not at the time of the rank list formation. So it could change over the course of your interviews, but this is a great opportunity for you to express an interest in a program that may be aligned with the mission and vision of the program, or may be aligned with the geography of the program. It may be aligned with your perception of that program being a good fit with your areas of interest. Next slide. We also certainly understand that geography is important. Even higher, 87% of folks who expressed a geographic preference said that was truly reflective of their geographic parts of the country they preferred to be in. Honestly, as someone who looks at applications, the signals do make a difference in terms of how I interpret the level of interest from an applicant. Geographic preferences are a little bit less delineated just because the geography associated can encompass a large number of states. As you can see from this map here, different geographic regions within the country actually encompass quite a large area. So it's a little bit less helpful, but it's still important for us to know about your interest geographically speaking. Next slide. So representing 771 programs does not mean that every one of the programs has exactly the same approach. The AFMRD does its best to try and coordinate information and provide some recommendations, but these are general overview kinds of recommendations. The AFMRD fully endorses programs taking a holistic approach to reviewing an application. Dr. Rudder talked a lot about the importance of how you talk about your experiences, maybe your research or publication experience. Honestly, your personal statement is the place where you really get to flesh out and tell your whole story. One of the things that I look for in an application is how it all fits together. The whole application really is how you get to tell me about your path through education, through life experiences, through prior work experiences, and how they all come together that have brought you to this point where you're making a decision about which specialty you want to choose and where you would like to go to residency. So be prepared to talk about those things. Your CV should be reflective of those experiences and important prior exposures. Your opportunity to tell me about the most meaningful experiences will help to guide the way I think about your application. And then your personal statement is the place for you to really pull it all together and tell your story. As Dr. Rudder mentioned, we want to see the experiences that you've gained from your clinical experiences in medical school. So you should be prepared to talk about patients and how they've impacted on your development. The other thing to keep in mind is that your application is also the place for you to address any, and I put in quote here, red flags. So whether that's a failure on one of your step exams, a failure of one of your courses in medical school, a leave of absence that needs further explanation. You do not want me to make up a story about why those things happened along your journey. You want to be the one to tell that story. So take the opportunity to address those things, to tell me what happened that you failed an exam, to tell me what you learned from that experience and maybe what habits or approaches to studying you changed in response. So seize the moment to be the one to tell the story. Don't let me make it up. Don't let other application reviewers make it up. You own it, tell it, and be prepared to talk about it when you get asked about it during an interview. Next slide. Away rotation expectations. Now, we understand that many of you are limited in your opportunities to do away rotations. But I would say particularly for those of you that were not able to do a family medicine rotation during your primary medical school experiences, or had a very limited family medicine rotation, I would strongly encourage you to look for opportunities to have a family medicine experience in a full spectrum family medicine environment. So we encourage applicants to seek these opportunities out. That will, I think, give you a better opportunity to fully explore the specialty of family medicine. It also shows your level of interest. And we want to see that you had the opportunity to work in a true full spectrum family medicine environment where you were caring for kids and older adults. Ideally, you are also maybe having some experience with a family medicine inpatient service and the opportunity to deliver a baby with a family doctor who practices obstetrics. So we encourage you to seek these out, but certainly understand that it is not available to everyone. Next slide. Letters of recommendation. I would say that most programs are going to expect to see at least one of your letters from a family physician. Again, this sort of speaks maybe to the prior slide as well. If you had very limited exposure to family medicine during medical school, this is another important step for you to take so that you have a family physician that can write you a strong letter of recommendation. I would say there are very few programs that expect all of your letters to be from family physicians, but we do want to see at least one family physician who really had the opportunity to work with you, get to know you, and who was able to speak to your strengths in a letter of recommendation. Next slide. Program signals, we've already talked about this. In family medicine, it is 5 signals, so that is not very many. We do recognize, however, that if you're applying in multiple specialties, you have signals to the other specialties, but only 5 within family medicine. So use those carefully. Clearly, historically speaking, 86% of you used signals to truly express your preference at the time of application. But also keep in mind, this is only at the time of application. And we're going to have an interview and further opportunities for reviewing your application materials. And you have additional opportunities to get to know programs after that initial application period. And so we understand also that things may change and that it is not necessarily something that is used in that final rank list process. Next slide. Some programs will ask for supplemental information. This will show up in the ARIS application and should be clearly delineated by each program that requests it. Many programs may want you to talk about why you are applying to their program in particular, so you should be prepared to answer briefly about what it is that attracted you to a particular program. Other programs that maybe have a particular focus on a language skill or obstetrics may ask you to speak a bit more about your prior experiences caring for patients that speak a particular language in your facility in that language, or that you're going to be ready to have a more high volume, high intensity obstetrics experience from the start of your family medicine residency time. So keep your eyes open for guidance from each program about whether they have supplemental application questions that they will expect you to answer as you're filling out that initial application form. Next slide. I want to make sure that all of our medical school applicants are aware that we will expect to see a step 1 and a step 2 USMLE or COMLEX exam. We don't expect to see both from our DO applicants. So sometimes medical schools will advise you to take both, but most family medicine residencies are not going to expect to see both the USMLE and a COMLEX. It's one or the other. Many family medicine residencies will review your application and may even offer an interview before they see your step 2 score. but they will not place you on a rank list until they see a passing step 2 score. So I know sometimes getting those exams scheduled can be a challenge, but do your best to stay on top of that process and keep it as early as possible so that you can present your step 1 and step 2 scores, USMLE or COMLEX, as early in the application process as possible. Next slide. So interviews, again, having 771 programs to represent. There may be a variety of different approaches to interviews. So you need to check with each program. I would say the majority of programs are still doing only virtual interviews. But gradually, since the pandemic, we've seen the number of programs offering in-person interviews gradually start to tick up again. Some programs offer both, a hybrid model of some virtual and some in-person interviews. But make sure that you're aware of what that program is offering, and I would encourage you to act as early as possible to get the kind of interview that makes the most sense for you. Next slide. Also keep in mind communication in general. The match does not encourage post-interview communication. Programs will usually indicate whether you should expect any kind of communication following your interview with a program. I received plenty of thank you emails and thank you notes after an interview. It is fine for you to send that as an indication of your interest, but you most likely will not receive communication back from the program following the interview process. As we moved to virtual interviews in many locations, one of the other options that has emerged is sort of the second look or open house opportunity that usually occurs at the end of the interview process. Keep your eyes open for each program and how they may offer this. The general recommendation is that programs offer the opportunity, if they choose to do so, for an open house or a second look after their rank list is completed, so that one's ability to participate is not a part of that selection process. But each program will handle that slightly differently. It is a great opportunity to go and get a sense of sort of the community and a better sense of how things are laid out and what the opportunities are in the local area if your interview with that particular program was a virtual interview only. Next slide. As it has already been highlighted, there are a number of resources for you to access. This is a great list as a place for you to start. I would encourage you to start looking at residency websites as well. Many residencies now also have Instagram accounts. That is sometimes a way for you to get a better feel of sort of the resident culture of different residencies. And I would encourage you to start taking a peek at some of the places where you are most interested. As we talked about in the very beginning, 771 programs is a whole lot for you to start figuring out how to sift through all of those. So as Dr. Rudder talked about, it's important for you to do your work right up front and think about how you can narrow down the things that are most important to you, whether that's geography, whether that's mission and vision, whether that's particular curricular components, but you need to start narrowing it down somewhere. I'll turn it back over to Cynthia to wrap us up and to open up the opportunity for some discussion and questions and answers.
Thank you again, Dr. Rudder and Dr. Woollever. We have reached the question and answer section of our time together. So we've got a little over 15 minutes, 17 minutes for Q&A. We will start with some questions that were submitted at time of registration and then move on to get through as many questions that were submitted live as we can. So the first question that was submitted was regarding advice on the best ways to decide what the best kind of residency is for an applicant. And are there benefits to picking academic versus community-based programs? So I will start with Dr. Rudder. What do you think?
Yeah, I think this is a great question. I think there's a lot of stereotyping that can happen with programs. I think there's a lot of students say, well, if you want to do, full scope, you have to go to a community program that's very rural so that you're not competing with residents of other specialties. So I think there's a lot of myths around there about this. And I would really caution you to do your homework on not just categorizing academic versus community, but recognizing there are many community programs that have amazing opportunities for research and quality improvement and public health information and all sorts of things that you would overlook if you didn't sort of broaden your view. So I guess the short version of this is every program is a little bit different. You don't want to go to an academic program where you're competing with lots of other specialties, but if you're an academic program that then really capitalizes on the facts that it has opportunity among a lot of different programs and residencies, then that's the place to be. If you're thinking about obstetrics, for example, and you're in a rural place and they transfer everything out to a bigger hospital, then you're going to get really good at transferring things out and not taking care of the patients. And so really working with the reading websites, talking to people who have experience, these are great questions on interview day with the residents, but I would actually caution people about stereotyping and putting programs into these two buckets without doing their research.
Dr. Willever, anything to add?
Yes, I mean, I think I totally agree with Dr. Rudder. Make sure you know what this means. Make sure you know what it means for yourself as well. What do you mean when you say academic? What do you mean when you say community? And do some self-reflection on what kind of academic work you would like to pursue. I would say most programs should be doing some kind of quality improvement work, which is maybe not traditional research, but can still be very academic and allows you to have a systematic approach to answering a clinical question, which is, as physicians, that's what we do all the time, every day. But yeah, I agree. Don't overgeneralize. Look at each program. Think about what's most important to you and what some of these words actually mean for yourself.
Absolutely. All right, we are moving on to the next question, and I'm going to bundle this with some live questions, but let's start with the one that's on the screen. For applicants who decided on family medicine later in the application cycle, what aspects of an application could be considered potential red flags, and what, because of time limitations, should be deprioritized?
So I'll start with this one. I think there's many students who take a long time to decide what they want to do. Some people, are 10 years old, decide they want to be a family doctor, and that's okay. And many of you don't realize until you're in your third year at the end in family medicine's your last rotation, and you're like, oh, this is what I want to be when I grow up. And so I would say that tell us your story. Tell us why family medicine spoke to you, even if it's late. I would say that family medicine is a beautiful field for lots of reasons. One of them is that it does not expect that you knew you wanted to be a family doctor from the minute you entered medical school. You are not behind the 8 ball. You will be fine. But use your application to tell why is family medicine matter to you. So maybe you always thought you'd do anesthesia, and really it was about, your commitment to making sure there was access to anesthesia care in rural areas. Well, that can be translated into stuff we do in family medicine. To what Dr. Willever said earlier, family medicine brings a lot of people in because of our broad scope of practice. And so whether it's a clinical connection or some other opportunity that you had that showed your passion, that somehow then clicked that family medicine was the right fit for you, tell us that part of the story. Family medicine does not have traditional sort of benchmarks of minimal amount of publications, minimal amount of hours, minimal amount of, times as a leader or something like that we're using as cutoffs to say, nope, this person wouldn't make a good family doctor. I think that's the beauty of the way our specialty is set up, is that there really is a holistic approach to each individual applicant. And while you may not be the perfect fit for Dr. Willever's program, maybe you're the perfect fit for mine. And therefore, finding the right place is going to be more important.
Perfect. And I'm going to address this next section to Dr. Woolever, and it's going to go broader with finding family medicine later in life. Let's say you've had a first career or second career, and now you're finishing medical school for a new start, and you've fallen in love with family medicine. How can you share those meaningful experiences of your journey with extensive experience in your past before medical school? And how far back can one go when it comes to the meaningful experiences section?
That's a great question. Honestly, if you take away one thing from this presentation today, I think you've heard both Dr. Rutter and I say, tell your story. Be ready to tell your story. And so prior experiences are a part of that story. I love seeing applicants that were teachers in their prior life, and then decided that, oh, I guess one of the ways that I could actually teach is to teach patients as a doctor. Then they go back to medical school. Honestly, some of those experiences we have really early in life, whether it is a crucial job in college or exposure to a community that occurred even in high school. Honestly, if it's meaningful and it's longitudinal and it's an interest that you have carried forward into your college and medical school days, it's not too far back to go and access that and incorporate it and include it. It's all about telling your story. The broader, just like the specialty of family medicine, we are about breadth and not depth. And so a broad background and prior experience helps to round out who you are as a human. One of my other favorite phrases about family medicine is that we're the specialty that humanizes medicine. We bring it into the real world of where our patients come to meet us or where we get to go to meet them. And we sort of humanize all the pieces that come together and turn into something that makes sense in the context of the real world. So your own prior real world experiences are fantastic and bring a lot to who you are as a future family physician.
Amazing. Thank you. Now we're going to turn our attention over to letters of recommendations. There's several questions about LORs also in the live chat. So again, there's going to be a bundling aspect. But this person pre-submitted, I don't have many family medicine letters. Can I include LORs from others? I think we heard through the presentation that yes, of course, we expect only one letter from at least one family medicine physician. Are there certain specialties that programs tend to value more than others? And if, let's say, there is a rotation that they are going to have with the FM doc, but it's later in the season, October, for the person that submitted a question live, how should they work in that letter and into their application at a later date? I will go with Dr. Woolever for this, and then Dr. Rutter, you can chime in.
Yeah, it's a great question. So no, I certainly welcome letters of recommendation from other specialties. If you are not sure which specialty you're choosing yet, that may be okay that the psychiatrist says, we would love to have this person be a psychiatrist, and talks about all the reasons that they would think you'd be a great psychiatrist. I would hope that if you're someone who's entertaining family medicine and psychiatry, you have sort of a notion of primary care psychiatry, or how you are not just sort of taking care of hospitalized psychiatric patients, but taking care of patients with behavioral health concerns in the community setting. And maybe a psychiatry letter of recommendation could speak to your commitment to sort of that primary care side of things, or the community-based application of behavioral health therapies in the outpatient setting as well. So I think there are things that you can do to coach your letter writers as to what your overall interests are that can make them more powerful letters, regardless of which specialty they're coming from.
Awesome. Anything to add, Dr. Rutter?
No, I would agree. I think that really you want letters that speak to recent experience, so I would say getting letters that speak to how you're performing clinically now is we value the opinion of all of our specialty colleagues. And so someone who can speak to your clinical reasoning skills, which is universal, your ability to communicate with patients is universal across specialties. Some of you may be at schools that don't have a Department of Family Medicine. And so we're not going to hold that against you, your inability to get that letter. I think it's really about the opportunity to speak to who you are as a person, tell your story, same sort of theme we've talked about, but give us a little insight from their side, from the faculty perspective, about who you are and what you would bring to a program.
Amazing. Thank you. This next question is a little bit more general, and it's outside of scores. What should international medical graduates, or really anyone, highlight or strengthen on their CV to really stand out to family medicine programs? And how about we go to Dr. Rudder and then Dr. Woollever?
Yeah, I think, there's sudden question as to kind of what highly competitive family medicine residency program means. And I think we typically think of that as places that routinely fill all their positions and rank, get their top applicants on their list. It's a little hard to know exactly what that means, or hard to get an interview with might be something that's seen as competitive in a desirable location. I would be really familiar with that program's requirements. So look on their website, see if they have anything published that says, we have cutoffs for our step scores, for example. A lot of programs don't have that, and which is why it's not published. But I would say make sure that you meet the criteria otherwise. There are some limitations based on the program or the institution you're with that if you're on a visa, for example, there may be challenges. And so it's not about you as a person, but it's about some of the restrictions that are put on the program by external forces. So just be aware of that. I would say highlighting, again, your commitment to family medicine now that you're applying to family medicine, that you are excited about primary care, that you're excited about the opportunity to serve populations, sort of that your values and your mission fit with the values and the mission of that program. They also may have some characteristics that are now on Residency Explorer about while research is not routinely a huge priority across family medicine residency programs, some may have that. And so it may be important to look at Residency Explorer and say, wow, I have good board scores and I have a lot of research experience, and that could make you a stronger applicant. So I don't know that there's a slam dunk for this one, but I would say sort of looking at their website, try to see what they're looking for and see if that matches with what you're able to provide them in your application.
Anything to add, Dr. Woollever?
Just getting back to telling your story, make sure that you have a good sense of what family medicine is all about and how your process has contributed to your thoughts around family medicine and how you will contribute to that specialty.
Yes, absolutely. Telling your story is such a huge thing. And we are now going to go to the live questions. So I'm going to pick some, hopefully in just the order of appearance. We have about 4 minutes left. So this first one is regarding the application itself. What seems to be the most time-consuming or challenging aspects of the application that most students take note of? Dr. Rudder, I'll throw this one at you.
Yeah, I think if you're a writer, the personal statement is easy. And if you're not a writer, that's the thing that students really trip up on the most. That it's time consuming, it's challenging, it's hard to, if you haven't been writing, it's hard to get back into writing. Medical school, depending on where you go, may not have a lot of opportunity for narrative or creative writing, although that's increasing in medical schools across the country. So I think it's often the personal statement. The CV is something you've done before. It's very checklisty. So it is something you can kind of discreetly do as a task. And most students do okay with that. For students that have leaves of absences or complex sort of journeys through medical school, coming to terms with that experience, writing about it, and making the narrative succinct and meaningful in the pieces that Cynthia, you mentioned at the beginning of how ERAS is changing, can be time consuming for those students. And making sure that your narrative is truthful and accurate and reflects what's going to be in your school's medical students performance evaluation or dean's letter MISPE is really important so that the story is consistent. And so sometimes for people that can be, but I would say universally over the years, the personal statement is the hurdle.
Absolutely. In regards to the personal statement, this was another live question, so I'm going to toss that in. Are there particular aspects that are more helpful to include in a personal aspect and highlight? Fellowship interests, a particular interest in OB, life stories, past meaningful experiences. What are your thoughts? I'll start with Dr. Woollever. What do you like to see in a personal statement?
Yeah, it's a great question, and I can imagine, while this is more Dr. Rudder's side of the equation, that this is where students spend a lot of time. Frankly, you should spend a lot of time. I read a lot of personal statements, and they are really important. They give sort of the human side of your application. Um, on the negative side, if they are poorly done and not well edited, and maybe bad grammar or misspellings, those are red flags in and of themselves. Um, it is a challenge to make your personal statements stand out and be memorable. But I have read personal statements that make me cry. I've read them that make me laugh. Tell a story. Catch my attention. I want to see how you reflected on a challenging time or a patient that changed your approach to who you want to be as a doctor. That's what I'm looking for. I think this maybe is probably pretty consistent within family medicine. It may not be across all specialties, but in family medicine, we are a clinical specialty. It's those patient stories that usually grab us and help us to see who you are going to be as a future physician, and the impact that you allow a patient to have on you as a human.
Wonderful. Dr. Rudder, I'm going to kick this next question over to you. And it is a question about research in the specialty of family medicine. How important is research to family medicine as a specialty?
I would say generally compared to some of our specialty colleagues, it is de-emphasized as compared to, what you're seeing in your roommate who may be going into specialties like orthopedics or dermatology, where we see many, many research publications and presentations as necessary. Research may be a passion of yours, a project you have done may be a passion of yours, and that would be extremely important. Research skills are not to be understated. We need more family docs who are doing research, and so it's a valuable skill set and experience to share for sure. But I would not, beat yourself up if you haven't done too much research, but think about the scholarly work you have done. Is it a quality improvement project? Is it curriculum building? There's lots of ways to define research and define scholarship and scholarly work. And so, but I will say that there will be programs that absolutely will excessively emphasize that. And so maybe some of the more research heavy programs will want to see bringing that to the table. But I think in general, across the board, it's de-emphasized as compared to our colleagues in other specialties.
Awesome. Anything to add, Dr. Woollever?
I would just add that we're going to be looking for sort of your depth of experience in research or project management and development. We're not looking for you to have 20 publications on your CV. If you have one that you were integrally involved with, or the lead author on, or had an absolutely important and crucial role, that's what we want to see, and that's what we're going to ask you about, and expect that you will be able to talk about in an interview. And whether that's traditional research or community-based activities or quality improvement, can be any of those.
Wonderful. All right, we are a minute over, so thank you again, Dr. Woollever and Dr. Rudder, for your time, and thank you everyone for joining. I will turn it over to Jennifer to close us out.
Great, thanks. Please do give us your feedback on this session. The evaluation will pop up on your screen as soon as we close out. We recorded the session. We'll email you once we post it. On behalf of the AAMC, have a great day.